knew this was going to be hard. What's up, everyone, and welcome back to my channel. In some ways, this is going to be a very different video from what you've seen on this channel before. I've been trying really hard to just put my head down and do really great videos that are informational and educational, but I have to be honest, I am so distracted because of what's going on in my personal life, and I feel like I wouldn't be as authentic as I claim to be if I didn't share why. So for the last few years, January has gotten harder and harder, and it has to do with the losses of both my maternal and paternal grandmother. In other words, my mother's mother and my father's mother both died within 3 months of each other. And as you can imagine, it's hard to lose just one loved one, but to lose two in the way that I did, it left me at a loss. In the aftermaths of their deaths, I found myself just yearning to see them again, to touch them again, to hear them again. Literally anything that I could do to just recreate the years and years and years that I had with these beautiful women on this earth. And I realized something, that over the years, especially with my father's mother, I had the wherewithal to save her voicemails. So I opened my phone, went to the voicemails. When I got to hear her voice again, I was over the moon. She actually had a voice disorder that we knew about. And I remember her being very frustrated with her voice when she was still alive. And I bet she had no idea that even with its flaws, and even when it wasn't as smooth as she wanted it to be, I, her granddaughter, would be obsessively listening to that voice over and over and over again. So in this video, I'm asking you guys to indulge me in honoring my grandmother's life. My grandmother passed away on Thanksgiving Day in 2021, and she was diagnosed with vocal fold paralysis about 8 years prior to that. Now, she didn't die because of the vocal fold paralysis. She actually had a diagnosis of sarcoidosis. I don't want to spend the time explaining what sarcoidosis is in this video, but I will leave a link in the description if you want to find out exactly what that is. I have some of her voicemails, and again, it's her talking to me. So let's just listen to what she has to say and listen for some of the characteristics of a paralyzed vocal cord.
Hi, Jeff. How are you doing? Just wondering how you doing in this storm. Okay, talk to you later. Bye now. Oh, hi, Jeff. Well, give me a call when you can. Okay, bye now.
Some of the symptoms that you may notice are a breathiness to the voice. That's because she had one vocal cord that was paralyzed and it was left in the abducted position or the open position. And even when she was talking and the vocal cord was expected to be slamming against the other one, it wasn't. And so she always had a sort of breathiness to her voice. Something else that is apparent is that there is something called diplophonia. Diplophonia basically is two different sort of frequencies going at the same time. That's because the air that was flowing against the paralyzed vocal cord versus the normal vocal cord caused two different kind of sounds to be happening at once. Something else that you notice that goes along with the breathiness is the constant need to kind of take deep breaths. That's because so much air is escaping through her vocal cords even when they're closed. So when she's speaking, it's almost like just doing a when you do the H sound, there's nothing obstructing the air from flowing through. It's honestly just an exhalation. So if you were to just exhale over and over, you're losing a lot of air. And that's essentially what's going on with that vocal cord that's left open. There's never a time that the air is being obstructed and kind of like held from escaping. Now let's talk about some of the treatments. I'm not going to spend too much time on the medical treatments because there are many and it all depends on the kind of paralysis that you have. But there are surgical procedures that can be done if voice therapy is not effective first. There are some treatments that include bulking, which involves injecting a substance into the vocal cord. It's similar to like when you break your leg and then you have a cast on, and when you take the cast off, the muscles have kind of shrunk. That's the same kind of concept. So bulking would just involve kind of beefing up the vocal cord back to what it was before the injury or, the disease occurred. Another treatment is actually similar to what I talked about with RFK. If you haven't seen that video, definitely check it out. But it's called a thyroplasty, and it's basically manipulating the vocal cords themselves in order to give a more functional voice. So for example, if the vocal cord is paralyzed open, the thyroplasty might include bringing it to midline so that it has a better closure and can meet up with the functioning vocal cord easier. There are also implants that can be placed in the voice box to better position the vocal cord so that it meets up with the functioning vocal cord better and then gives an overall better voice. If a person has a bilateral vocal fold paralysis and they're stuck in the closed position, this is actually incredibly dangerous because they need to be open in order for you to breathe. So a person may need a tracheostomy to totally bypass the vocal cords and give adequate airflow into their lungs. Okay, and talking about voice therapy, I did do a video where I talked about different voice therapy techniques extensively. So I would recommend checking that out because some of those techniques can be effective with a vocal fold paralysis. Okay, if you made it to this point in the video, for one, I hope that it was incredibly helpful to you. If you are someone who has vocal fold paralysis, as always, I encourage you to speak with your medical professional about that. And if you haven't already, definitely seek out a speech therapist who is trained in voice therapy. I wouldn't be able to finish this video without doing a small tribute to my grandmother. My grandmother's name was Elise Rose Jones. She was born on June 18th, 1941. She was born in Waterbury, Connecticut. She was one of 13 children. She had 4 of her own biological children. She also raised 3 nieces and nephews. She has a host of grandchildren and even more great-grandchildren. She was the strongest believer in Jesus that I know. She was loving. She was incredibly caring. She was actually a nurse and she worked for longer than I was alive, obviously. But at the end of her career, she spent time working with hospice patients. And I don't know if any of you out there work in hospice, but it takes an incredibly special person to choose to work with those who are actively dying. And my grandmother never hesitated for a second to do that job and loved doing that job. And even when she was no longer working and she was advanced in her disease, unable to walk very far, unable to really leave her house, she took the time to read the newspaper every day, looking specifically at the obituary section, and taking the time to learn about the lives of those who are no longer with us. She recognized that every person in that section was a living person at one time and had a story to tell. And although death was the end of that story, their lives and their stories lived on in those that they left behind and those that loved them the most. I like to think that my grandmother passed on many traits to me: my looks, my smile, my demeanor, but something that she definitely left with me is the understanding that the people that we work with, me as a clinician and her as a nurse, they are people. They are not just diagnoses. They are not just cases. And with each person that I treat, I always honor the fact that they have a life outside of whatever they're working on. I said it before, but I know that when she got that diagnosis, she wasn't necessarily happy with her voice. I pray that she understands how important her voice is to me now. And I hope that I can make her proud with this video and the life that I choose to live going forward. As always, thanks for supporting this channel. Thank you for watching this video to the very end if you're here, and I'll see you guys in the next one.
I'll call you later. Okay, bye now.